An inguinal hernia usually shows up as a bulge in the lower abdomen, also called the groin, or in the scrotum. Before birth, a male's baby's testicle grow inside his abdomen and then travel to the scrotum. To get to the scrotum, the testicles must pass through two openings called the internal and external inguinal rings, and a passage between them called the inguinal canal formed by abdominal lower muscles. As the testicles enter the scrotum, tissue lining the abdominal wall comes with them, forming a sac. Normally, the internal inguinal ring and tissue sac close after birth. Sometimes, for unknown reasons, the internal inguinal ring and tissue sac don't close. As a result, the open tissue sac may fill with fluids that normally stays inside the abdomen. The fluid-filled sac surrounding the testicle is called a hydrocele. A small piece of the baby's intestine may also slide into the sac, resulting in inguinal hernia. Sometimes, a doctor may be able to gently reduce or push the intestine back into the abdomen. However, the intestine may become trapped or incarcerated inside the tissue sac. After about 6 hours, the intestine inside an incarcerated hernia may lose its blood supply and die. This is called a strangulated hernia and is an emergency that requires an immediate surgical procedure to correct. Hydroceles and inguinal hernias require an operation to tie off and remove the tissue sac to prevent future herniation. The surgeon will make a small incision near the hernia. Next, the surgeon will carefully separate the tissue sac away from a cord structures attached to the testicle. The surgeon will then open the sac to look for any herniated contents inside. Usually, the sac is empty. However, if herniated contents are present, they will be moved back into the abdomen. In children younger than 2 years of age, the surgeon will insert an instrument called the laparoscope through the open tissue sac. The laparoscope contains a camera that will allow the surgeon to look at the tissue sac on the other side to make sure it is not open. If it's open, the surgeon will need to make similar repair on that side. After checking the other sides for a hernia, the surgeon will tie off the empty tissue sac with a suture. The remainder of the sac will be removed. Finally, the surgeon will close the incision with dissolvable sutures, skin glue, or closure tape dressing. The baby may receive an injection of anesthesia in the skin near the incision to help control pain that happens after the procedure.